There are various approaches to e-health, and these approaches to e-health are based on electronic health records, electronic medical records, enterprise health information systems, mobile health information systems and communication, as well as telemedicine. So all these are under the umbrella of e-health, which is electronic health. The reason why I picked these courses or aspects or these variables or these methods of healthcare delivery based on digitization is because of the way people are misconceiving these particular terminologies. We always have a critical look academically and even practically on how these differ from each other. For instance, when you say electronic medical records, you don't mean electronic health records. Because each time we talk about electronic medical records, we are talking about a digital exchange of information within clinics in a single healthcare facility. Single what? This appeared in your MCQs. You know, EMR, you know, facilitate exchange of information within a single healthcare facility. Or it doesn't allow sharing of information across multiple healthcare facilities. I think you've seen something like this. So it's just within, like this teaching hospital actually is only operating on the basis of EMR, which means electronic medical records. Okay? But when we said electronic health records, this is the terminology that is haphazardly used. It is carelessly used because actually most of the softwares we are calling electronic health records are nothing but electronic medical records, because they don't allow electronic health records by definition or explanation means the patient records, which is in digital format, can travel across various healthcare facilities. The health information can be accessed at specialist hospital. It can be accessed at teaching hospital in another state, or even in Abuja, or even in another country. Once you are looking for the information of a particular patient, you can be able to access it and the continuation of care can continue. But this is hardly achieved. Because even in some countries, you know, that are very advanced, they put a very high budget and yet they have not attained that standard. I will also know of some certain countries that even before you encourage digitization, you have to pay incentives to the hospitals and clinics that are using technology, digitization, in order to manage their health information. So you have to be paying them some certain allowances monthly so that they keep on doing. Otherwise, people would not do it. That is part of, you know, adoption of technology. You have to bring people into the process. And, you know, to bring people into the process at times, you have to incentivize them. You have to motivate them. You have to give them some certain money that will make them happy. Like me now, if each time you come to lectures, maybe I share some money, maybe the class will be full. So it's something like that, you know. So you have to motivate people, you know, to bring them into the change process. So that's the reason why. But even in doing that, we have to be very, very careful with all, the concept of what? Medical identity theft. You remember where some data of information can be stolen, that they've been treated in one facility in order just to get a claim. More so in the era of AI now, AI is linked to some softwares which it can also generate false data, and, you know, you pass it to certain agency that will make payment for the claims, and it will be paid. So we all have to be very careful in that. That's what we need: a strong data privacy, security, and also to comply with some regulatory frameworks or laws that are binding the use of health data and health information. For instance, in America, we have HIPAA, which is Health Information Portability and Privacy Act, which has a lot of regulations, to protect, patient data. In Europe, we have what we call General Data Protection Regulations, which also protect health information data. In UK, that is United Kingdom, we have National Health Service Information Governance too, which tend to protect, data or patient based on ethics law and policies. And in Nigeria, we have what? National Data Protection Commission. What is the name of the agency? National Data Protection Commission, which tend to, protect data and information of a patient based on some certain acts, laws, policies. All this is to safeguard the privacy and security of the health information, to ensure integrity, confidentiality, and availability of the records. Okay? So, the basic difference between EMR and EHR is what? What is the basic difference that we said is that this one, it allowed multiple sharing of data, the other one is restricted to a single facility. So what about the enterprise? What about the enterprise health information systems? What about the enterprise health information systems? The enterprise health information system, for you to know the meaning, you have to start from the keyword, that enterprise. What does enterprise sound like? Huh? What does enterprise sound like? The enterprise sounds like a business entity, is it? Even for those doing business, when you are registering your business, some register it based on limited, some enterprise, some is it a company. The company is the biggest enterprise, biggest registration, and it also has some budget that can be used, to set up that company. So when you hear enterprise is business, so why is it called enterprise health information system? That's because it's more of a business solution. What makes it business solution? When you are doing a healthcare business, a clinical business, nothing concerns you with billing in the software. Nothing concerns you with inventory management. Nothing concerns you with administration and personnel management in the software. Why? Because that will make it a more of business orientation. And that's even the kind of software solution which most of our healthcare institution wants. They are more concerned with the business aspect in terms of revenue generation, what is available in the store, what can be used to manage personnel, rather than the clinical component of it. So for you, as students of data and health information, once you want to know what type of software solution is for you to read it. To read the background of that particular software. What are the functions? What are the features? And the moment you see something like billing, like accounting, like inventory, then it's not an electronic medical record, and it's not an electronic health record, but it's an enterprise what? Health information systems. So that's the reason why even before you get a software, you need to know all the features, components, and the functions and functionalities of that particular software. That will now give you the idea of what type of software it is, and you can even advise your management. Gone are the days now when someone will just bring a kind of disk and maybe say this is a software that you can install into your system. That may not now work because people now need to know how it works. You need to implement it. At times, some of the features does not even work. At times, it doesn't fit into the requirements of that particular organization. That's the reason why we need what we call requirement analysis. For you to even deploy a software, you need to do your own requirement analysis of that particular organization. That's like the need analysis. What do I need? What type of software do I need? Otherwise, it's like